Hello, student. Am I audible and visible? Let me know. Am I audible and visible? Let me check. Am I audible? My voice is audible? My voice is audible? Okay. Just a minute. Hello, everyone. Welcome to Unacademy Future Doctors. I myself, Dr. Dipti Kariya. I'm MD, PhD Physiology. I'm Associate Professor and educating MBBS, MD, Nursing and Physiotherapy students. I have more than 17 years of teaching experience. Now, let me explain in brief about our subscription. We have two kinds of subscription. Number one, that is plus subscription, in which you can choose the best from the best. Here in plus subscription, features are you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank, which is having more than 25,000 questions. You can compete in the live test and quizzes. As well as within 12 months, we are coming with our printed notes. Second, that is iconic subscription. Here, your access to the best from two of the best. Which are these two? One that is Unacademy and Prep Ladder with Unacademy, and second one that is Unacademy and Prep Ladder with Prep Ladder. Here, in sorry, in first one, features are you can have well-structured live batches, you can have recorded classes which covers full syllabus, question bank which is having more than 25,000 questions, you can compete in the live test and quizzes, you can have comprehensive printed and digital notes. Whereas in the second one, on Academy and Prep Ladder with Prep Ladder, the features are you can have clinical and integrated essential. You can have video lectures from the Dream Team, Question Bank 3 with active guidance system tags, and much more. Rapid revision and snapshots and treasures in 2021 Dream Notes. So both have unique features and you can select any of them. So you can subscribe from your mobile, either plus or iconic subscription. You can use my code DIPTI10 to get 10% extra discount. Longer the duration of subscription, cheaper are the rates. Now, some other features of our special class. They are you have interactive live classes. You can attend the live class as well as you can participate in this live chat. Your doubts get cleared during the class. Here, second characteristic here is you can have an option of raise a hand. You can talk to your educator in the live class and you can solve your doubt. You can also poll for the learner. You can never miss a class as you are always notified for the lesson, upcoming courses as well as recommendations curated. Lecture notes also you can download as well as you can get access to the recorded sessions of live classes and you can attend live classes and participate in live chat at any time. Here these are our NEET PG 2021 toppers. Congratulations. Another, this is our schedule for Unacademy Medical PG test. You can see here different tests. We have a schedule for all this test you can have if you get the subscription. Our another batch is that is FMGE 2022 batch. It has started from 15th December, which is for 6 months. And second one that is Target NEET PG 2022 test and discussion batch. That is started from 15th December, which is for 3 months. Okay, now, so I will now start my topic here. Our today's topic is pulmonary diffusion. Now, first of all, let me clear this. In this channel, Unacademy Future Doctors, we are placing videos. All these videos are free to access. You need not have to subscribe here. They are just free to access. So please watch all those videos. These are very important for MBBS university exam going students as well as those who have taken admission or those who are planning to take admission. So if you have anyone in your family or friend or your junior, you can share all those videos with them. They will be very, very useful for those students. Okay, now let me start the topic. So today's topic is pulmonary diffusion. The diffusion itself suggests what is the definition of diffusion? Diffusion means transport of substances along the gradient, or you can say from higher. Suppose here is the higher concentration, here is the lower concentration. The substances are transported from higher to lower concentration along the gradient. And these gradients are either concentration gradient or pressure gradient or maybe the electric gradient, negative to positive. Okay, so these are transported along the gradient. Here we are discussing about pulmonary diffusion, means in the lungs. In the lungs, gases are transported along the gradient. Okay? So gases are transported from higher to lower concentration. So suppose oxygen is more in the alveolus, so it is transported from alveolus to the blood vessel and carbon dioxide from blood vessel to alveolus. This is diffusion. Okay, now we will discuss different laws of diffusion. First is physics of gas diffusion. Now, what is this gas pressure? Whenever any gas molecule is there in any container, you can see here they are continuously in motion and they have kinetic energy. Okay? So here, because of this energy, they bounce with each other, you can see, as well as they also bounce with the wall of the container and they exert pressure. This is gas pressure. Okay? Now, this gas pressure exerted, it depends on three factors. Number one is concentration of molecules. When concentration increases, pressure increases. Volume of the gas and temperature. Volume increases, pressure increases. Then absolute temperature. Temperature increases, that also affects the gas pressure. Now, so here you can see this pressure P is equal to nRT. I think all of you are knowing this formula. So you can see this P is inversely proportional to volume. So pressure increases, volume decreases. You can see here, suppose you have 1 liter of gas at 1 atmospheric pressure. Now, so this is 1 and this is also 1. This is constant. Suppose you are increasing the volume. So volume becomes 2. So now how much would be the pressure? Pressure would be, suppose this is constant 1. So pressure would be 1 by 2. Clear? So pressure is half. Same thing here. When volume is half, pressure would be double. So same way you can see here, P is equal to nRT is 1. Volume is half. So pressure becomes P is equal to 2 atmosphere. Okay. So this is the law, PV is equal to nRT. Now, next is partial pressure. For that, we have Dalton's law. This one is Dalton's law. According to this law, partial pressure exerted by any gas. Okay? So all these partial pressures, they unite to form total pressure. You can see here, total pressure is equal to Pn2. Suppose we are talking about total pressure of any gas mixture. So it is equal to P partial pressure of nitrogen, partial pressure of oxygen, and partial pressure of water. Other are in very small amount. Total pressure is equal to partial pressure of all mixture of gases. Now, if you want to find out partial pressure, so partial pressure, that is pressure exerted by one gas only. For example, suppose if we want to find out partial pressure of oxygen. So oxygen is 21% in our gas mixture. So you can say in 100 oxygen is 21. Then in 760, how much is the pressure? So 21 into 760 upon 100. So oxygen partial pressure is 160 millimeter of mercury. Am I clear? Okay. Next is Henry's law. What is this Henry's law? Here you can see in Henry's law, when we keep the temperature constant, what happens? According to this law, if the temperature is kept constant, amount of the gas which is dissolved, that is proportional to partial pressure of the gas. Means more the partial pressure, more will be the dissolved gas. This I will explain you with the example of soda bottle. Suppose you can see this is unopened soda bottle. It has gas with pressure. More pressure, more will be the gas in dissolved form. You can see here less pressure. When you open it, pressure decreases. Less amount is there in the dissolved form. So you can say Henry's law denotes that when temperature is constant, then amount of gas in dissolved form is directly proportionate to partial pressure of the gas. Okay? So if we increase partial pressure, we can increase dissolved gas. Okay, we will discuss what is its significance. Now, rate of diffusion, net rate of diffusion, it is the formula is same. Diffusion is equal to delta PAS upon T pi molecular weight. Here pi is constant. Delta P is the pressure difference. A is the cross-sectional area. S is the solubility of gas. Molecular weight. D is the distance. So when this pressure changes or surface area or solubility changes, this diffusion rate increases. They are directly proportional. But when molecular weight increases, diffusion decreases. Okay? Now, some other small topics may be asked as a short question we will discuss today. One is dead space air. One of the important small question may be asked. What is dead space air? Dead space air means amount of air present in the dead space. Now what is dead space? It is the space of respiratory passage from our nose. Here we start from the nose here to the up to here you can see terminal bronchiole, this one. This is our dead space air. Why is it known as dead space air? Because here gases cannot be exchanged. No gas exchange takes place. Okay. So this is known as dead space air. And amount is 150 ml. So suppose your tidal volume is 500 ml, from which in every breathing your dead space air is 150 ml. Okay. Now, next is anatomical and physiological dead space. What is it? Anatomical dead space means the dead space we have defined from nose to terminal bronchiole. That is anatomical dead space. Now, what is physiological dead space? Physiological dead space is equal to anatomical dead space plus alveoli. Suppose, normally this is not the dead space, but suppose this alveoli are not participating in the gas exchange, then this is also known as dead space. So this is physiological dead space. Okay, physiological dead space is equal to anatomical dead space plus alveolar dead space. Now, so in which conditions alveoli they are converted into dead space? They are converted into dead space in if there is respiratory disorder like emphysema, or emphysema, that is restrictive disease, bronchiectasis, or pulmonary embolism, in which alveoli they get ventilation, air is coming here in the alveolus, but blood flow is not there. So no diffusion. If there is embolism, blood is not flowing because of blockage. So there is no diffusion. Then that is alveolar dead space. Okay, you can see here. This is your anatomical dead space. This one. This is physiological. You can see here in this alveoli, no gas exchange. Okay. Now another diagram also we have here. You can see. Sorry, just a minute. This is pulmonary embolism. What happens here? There is embolism, means no blood flow. So alveolar air cannot take part in the gas exchange. This is dead space. And second is obstruction, like in bronchiectasis. If there is obstruction, so what happens? There is no air is flowing. Okay, then also there is dead space. Now, how to measure anatomical dead space? For that, there is Fowler's method. This may be asked as a short question. What is this Fowler's method? Here, ask the subject to inspire pure oxygen. You can see here. Okay, pure oxygen is inspired, and ask the subject to expire here in the nitrogen meter. So what happens when person inspires pure oxygen? So what happens? All the respiratory passages, they are filled with oxygen, including your dead space. Now, when the person expires, initially which air comes out? The air which has entered last. Suppose these are your respiratory passages here. Okay, air is entering here. So last one air is here, this one. So when you expire, this air comes out. Okay, now, so initially you can see when the person is expiring in the nitrogen meter, there is no nitrogen initially. Initially oxygen is there. Why? Because air is from your Anju Agrawal. Hello, I'm fine. So here you can see, so whenever person expires first, this air containing oxygen only, it is coming out. So no nitrogen is there. And afterwards, nitrogen is coming out when your alveolar air starts coming. Okay. So now how to measure dead space? You can see here, this one is alveolar air. This is your, sorry, this one is alveolar air. This is your dead space. Okay. So you can see area of gray upon total area multiplied by tidal volume expired. Okay. For example, suppose 500 ml is tidal volume. Okay. So from which dead space air is how much? So you can see here, gray area is dead space. This is total area. So suppose your total volume expired. This is ideal. This is normal tidal volume. Okay. Suppose you have expired 400 ml. Okay. From 400 ml, your dead space is 125 ml. 125 ml. So from 500 ml, how much? So you can calculate anatomical dead space. Okay. So you can calculate area of gray upon total area multiplied by tidal volume. Okay. Then next is physiological dead space. So physiological dead space measurement, for that we have Bohr's equation. What is this Bohr's equation? Here nothing, but the thing is, in Bohr's equation, your PV is equal to constant, or you can say pressure into volume of expired air. Try to remember, this is quite difficult. Is equal to pressure and volume in inspired air. Okay. Here we are using carbon dioxide pressure and volume. Okay. So now, so pressure and volume in expired air, you can see here, expired air volume. This is your tidal volume, and expired air pressure. So pressure of carbon dioxide in expired air, volume of carbon dioxide in or volume of expired air is equal to, now this inspired air is divided in two parts. One that is dead space and second that is alveolar air. Okay, so pressure is same. Here you can see this is your alveolar air volume, you can see here, multiplied by partial pressure of carbon dioxide in alveolar air plus dead space air volume into partial pressure of carbon dioxide in dead space. Now here, this partial pressure of carbon dioxide in inspired air is 0. So this whole becomes 0, this one. Okay. So now, what you have to place in this, you can see here, partial pressure of carbon dioxide in expired air multiplied by volume of expired air is equal to this alveolar air, again you can divide into tidal volume minus dead space volume multiplied by partial pressure of carbon dioxide in alveolar air. Okay, so if you know partial pressure of carbon dioxide in expired air, if you know tidal volume expiration, know tidal volume inspiration, partial pressure of carbon dioxide in alveolar air, you can get this dead space volume. So this way you can calculate physiological dead space. Okay. Now next is your alveolar air. Now how much is your alveolar air per breath? That is tidal volume minus dead space air. Tidal volume is 500 minus dead space 150. So this will be 3 ml. Now, so this is your alveolar air. You can see here air enters in the alveolus. Okay. Now this alveolar air definition we have already defined. With each breathing, how much air enters in the alveolus? This is alveolar air. Volume of alveolar air. Normally in the alveoli we have FRC volume 2300 ml. Okay. Plus every time your 350 ml is being added. Okay. Now composition we will discuss. You can see it is quite different from atmospheric air. You can see here. If atmospheric air has 78% nitrogen, this is 74%. Alveolar air has 20% oxygen, 20.84, 21%. This has 13%. Atmospheric air has 0.04% carbon dioxide, this has 5%. Water vapors are more here, 0.5% in the atmospheric air, 6% in alveolar. In total, they are same. Now, why the difference is there? Number one, water vapors are created. And you can see here in this, water vapors are more. This percentage 0.5 and this is 6.2. Second thing is slow renewal of alveolar air. Our alveolar air, because 2300 ml is our which air FRC, okay, in which your 350 ml air is replaced only. So slow renewal. Third thing, continuously oxygen enters. Your inspiration and expiration, they are cyclic processes, but gas exchanges continue. So constant absorption of oxygen and constant diffusion of carbon dioxide. Okay? Now, next small definition is alveolar ventilation. So what is alveolar ventilation? This was alveolar air. Don't get confused here. It was alveolar air. This is alveolar ventilation. And another is pulmonary ventilation we discussed. Pulmonary ventilation is equal to respiratory rate multiplied by tidal volume. All these are small questions may be asked and you get confused. Alveolar ventilation is equal to alveolar air multiplied by respiratory rate. Alveolar air is 350 ml, respiratory rate is 12. So this is 4200 ml. Okay? Now, so what is the physiological significance of alveolar ventilation? Now, let me explain with an example. Suppose some subject, one subject A, His tidal volume is 500, respiratory rate is 12. Okay, so how much is pulmonary ventilation? 12 into 500 is equal to 6000 ml per minute. Okay, another subject is having tidal volume 200, respiratory rate 30 breaths increased. So rapid breathing is there. So pulmonary ventilation will be 200 ml multiplied by 30. Again 6000 ml. So you feel that ventilation is same, good in both the individuals. But which situation is better? Because in subject A is doing deep breathing. Subject B is doing shallow breathing. Fatafat. So now, what happens here? You can see here. In subject A, how much is alveolar ventilation? 12 multiplied by 350. Because you are subtracting your dead space air. And your alveolar ventilation is 4200 ml per minute. But if we are talking about subject B, what would be the alveolar ventilation? That is respiratory rate multiplied by this one, alveolar ventilation. Here alveolar ventilation is only 50 ml. So 330 into 50. So only 1500 ml per minute. You can see this is too less here. So which condition is beneficial? This one. Deep breathing, less respiratory rate. Okay. Now, so this is all about today's topic. And some of the questions from today's topic, you can note down all these questions. One, that is respiratory membrane. We will discuss this also in detail. Alveolar air, alveolar ventilation, dead space air, normal dead space volume and its measurement. And this topic is slightly lengthy. We will discuss it tomorrow along with pulmonary compliance, ventilation, perfusion ratio. This is left. Okay. In my next video, you can watch this topic. Okay. So this is all. Thank you. If you like my video, you can click the like button. You can share with your friends, juniors, family members. They will be benefited, and you can subscribe our channel. Another important announcement here is today only I'm going live for my special class. You can attend the special class in which we will discuss about transport of gases, one of the very important topic of respiratory system. Transport of oxygen and carbon dioxide. So you can watch continuation of today's class as my special class. You can watch it live as well as afterwards also. You can go to the app and you can watch the class. That class is also free.